Dr. Azizian here. Welcome back. Today, I would like to switch gears and share my thoughts and my philosophies, my approach to both functional medicine and conventional medicine. And as I get started, I'd like to tell you this story, which I think it's a true story. It was told to me about 20 years or so ago, maybe a little more, by one of my mentors, a surgical attending when I was a surgical resident. And this is how it goes. So he was on call one night. It was a busy night, and a patient came in who had what we call an acute abdomen, meaning that she needed an emergent surgery due to perforation. So as she was being taken to the operating room, she had this shawl that she was clinging to. And she asked that she was allowed to go to the operating room with this shawl. And of course, because of the concerns for sterility, she was not allowed to take that shawl with her. And the shawl was given to her relatives who were waiting. And then after surgery, it was a complex surgery. She was not in a good shape, so she ended up in an intensive care unit. And she had a bunch of complications, and every day she was getting worse and worse. And for a moment, apparently, she opened her eyes and she said, "If I don't get my shawl, I don't think I will make it." So, of course, at this point, she was given back her shawl in the intensive care unit because it was put probably over the blanket that she had on. And then miraculously, she got better in a few days. Eventually, she was able to wake up completely, and eventually, she did go home. So now many of you could chuckle listening to the story. Is it even true? It's hard to tell. I do believe that story because I know that the person who told me this story is a very serious and analytical, no nonsense surgeon who is not prone to some fairy tales and magic thinking. So it's an amazing story in a sense that it's amazing because it's coming from him. And we know people who like to embellish things and tell stories like that all the time. And those type of people, I'm sure that we all discount what they say. So what does the story tell us? What is the meaning and why am I even bringing it up? I'm bringing it up because in functional medicine, one of the important approaches is to level with the patient, to be on the same wavelengths as the patient. And in this situation, for some reason, for nostalgic or some preformed beliefs, the patient was attached to the shawl. Does it make the shawl magical? Of course not. But for this patient, it had a meaning. And of course, many of us would say, well, she was getting better already. She did wake up for a few minutes to request a shawl. So that's why it's not surprising that she got better. And I would agree with that too, that it may be all a coincidence. But for some reason, this attending, my mentor, was very impressed by that. And he even told me that. And over the years, I kept thinking as to why he shared that with me. And I think that he felt comfortable sharing with me because he felt that I would not be judging him and I would understand that story. Because 20 or so years ago, that would not have been appropriate to share in a professional setting because it was just a too far-fetched of a story and it was almost like a voodoo magical story. But I appreciate it. And to me, it feels like a gift that he shared. And essentially, in some ways, do I believe in it or not? It is almost irrelevant. What is important that that patient believed that the shawl was magical and she got better. So that's all that matters. So coming back to functional medicine. So talking about functional medicine, we always talk about individualized and personal approach. And what does it mean? It means that we take into account patient's spiritual, emotional, mental life, and those words that we use a lot these days, mental health, that includes all aspects of mental health, and combine it with their medical data, with their data from their physical exam, their blood work, or x-rays, EKGs, etc., etc. So all of it makes this person a unique person. and add to this their genetic makeup, which is a very fascinating part of medicine in general, then you have this unique person. And for each person, the treatment has its nuances. It's slightly different because it's based on certain characteristics of your body or of your habits. Another big part of functional medicine approach is to ask patient about their lifestyle. It's incredibly important to know what is this person's diet. Not the diet that they often make up and it seems all perfect, but do they snack at 1 a.m.? Do they go to fast food when they are stressed, for example? What is their regular dietary pattern? Or another very important thing is sleeping. For example, if somebody is not sleeping enough, their blood pressure will be less controlled. So they would need more blood pressure medication. So their dosage may be increased or another blood pressure medication may be added. So the sleep directly affects what we're doing medically. On the same note, the stress level, I don't even need to go into this. It's so important. The exercise routine. Is this person that just walks 2,000 steps a day and that's it? Or is it somebody who is doing weights 3 times a week and walking 10,000, minimum of 10,000 steps a day? So those are factors that make us all unique and they need to be incorporated. So in my love for functional medicine is the way I look at it. I look at it as addition to conventional medicine. I don't look at it as a separate entity. I look at it as an addition to what we're doing, but doing it with more heart and with more knowledge. But there are few points that are very important to make this happen, to make these two areas of functional and conventional medicine integrate. The first one that I'd like to discuss is time. So how does time impact all of us? So when, let's say, you go to a doctor, how much time do they spend with you? That is very important. Not only how much time they spend with you, but also what is that time spent on? So I will give you an example. For example, when a patient comes to our clinic, let's say they have some kind of a concerning issue and there's a suspicion from the primary care provider that it may be a cancer, and that's why they're sent to our clinic. What we do at our clinic was first we have a nurse talk about sunscreen and the usage of sunscreen and not doing any tanning, and of course about the dangers of the tanning bed. That's our pre-printed sort of conversation, and we also have a little paper to that effect as well, an educational material. And then when I go in and meet or greet the patient, we do talk about sunscreen again. Well, mostly it's me who's talking about sunscreen. And sometimes if it's a new patient, I could see by the glazed look in their eyes, they're like, well, hurry, let's get to my problem. So, but I always go over my sort of scenario that I need to communicate. So all of these factors that use sunscreen all year round to the face and in the summer areas that are exposed and et cetera, et cetera. I think I memorized this script for the rest of my life. So, and I see that glazed look, and then we finally get to the problem that they're here for. And in many cases, indeed, it is a skin cancer. Sometimes it is somewhat of a concerning skin cancer. It could be melanoma, for example, or a large squamous cell or basal cell carcinoma. And in this situation, I could, of course, sense that the distress that patient is feeling. And I say, we will talk about the procedure, the risks of the procedure, the post-procedure, post-operative instructions, and don't worry, everything will be fine. But right now, I would like to go back to sunscreen again, because talking about sunscreen is essentially talking about prevention. We can take care of this problem. However, we would like to prevent this to happening, let's say, on another arm or on the back or someplace else on your body. We would like to use this opportunity to prevent that. And if I, as a physician, do not say that, if I don't point this out, I think that I'm not doing my job. Prevention is or should be a huge part of medicine. It should not be an afterthought. It should not be just a little paper that we give and say, oh, yeah, you can read it at home, because most people just take it and they don't read any of this. So that's what prevention is. And of course, now that I go the second time and we talk about that some sunscreens have chemicals and how to avoid these chemicals. So now patient starts asking me questions. They say, oh, where can I get this sunscreen? I said, well, at CVS or whatever, how and what SPF. So now they're engaged because they understand that there is a correlation between using sunscreen and between the cancers that they're having. This is not some empty words. So another scenario that I can see, it's a very, very common scenario nowadays. If a patient, let's say, comes and requests prescription for Ozempic, and of course, practitioner could just say, oh yeah, here's your prescription for Ozempic. And sometimes it does happen that way, unfortunately. However, what needs to be done, and in a world of functional, or I would say in a world of blended medicine, this patient needs to have space to open up. Why are they overeating? For example, this patient may say, well, every day on the way to work, I eat, I don't know, 5 donuts. And that way I can get through the day because my boss yells at me and my coworkers are, nasty. And this is just horrible. I hate my job, etc. So then you understand that the problem is their job. It's not necessarily that they are helpless and lose control around the food. They use food for certain purposes, right? And if that is not asked of the patient, if that is not even delved in any way, then what happens, the relationship between medical provider and the patient becomes almost robotic, that it could be accomplished by an AI. Essentially, you come in, you ask for a prescription, it's given, and you don't look inside. And that is the beauty of medicine, because medicine is both an art and science. So it has to be practiced as such. And I'm not saying that every physician should become a psychiatrist or psychoanalyst and go into every permutation as to why somebody overeats or has whatever bad habit. However, without looking at it, without initiating the process of improvement, we can't really help that patient. And what would happen if, for example, that same patient gets their Ozempic and then they develop blurry vision and vision problems that are now being reported in small percentage of patients who take Ozempic, or develop some other side effects. Why? Maybe all they need is to quit their job. Obviously, that's not something that medical providers should recommend, to quit your job, but to have in place a system that has the counseling, has qualified personnel to address that, and to use that multifactorial and multidiscipline approach. And I know that we use those words a lot in medicine, but we don't have enough of it. That's really would be the key, and that would show integration of internal world of each of us when we're a patient, and also how we interact with the medical system. And there are some places where it works like that. And I applaud these places where they do have this multidisciplinary approach. But unfortunately, that relationship, sometimes an expectation that it would be like a mechanic or a robot that you will just come and request and get that, I think that is wrong. And that should not be part of medicine, because it just destroys any trust. It destroys any authentic component in that relationship. So what would happen if we all had time? Why am I bringing it on the sort of section of time? Because time is very limited in our communication with the patient. We have 15 minutes, sometimes 30. If we're very lucky, then we would be allowed to have a long 45 or 60 minutes initial visit with the patient. It is allowed sometimes. So, and what would happen then? Of course, we love the time, because the time is, that's how you get to know somebody. For some people, it may take 10 minutes just to feel comfortable, because Those 10 minutes may have to be dedicated to having an innocent conversation about weather or some similar topic just for a patient to be comfortable, because patients also are not some robots that we can push a button, say, well, open up and just tell me what are your psychosomatic symptoms, why are you doing this and that. And it doesn't work that way. So I truly, truly believe that 95% of my colleagues, if they had opportunity to spend more time with the patient, they would have loved it. They would have used it, and they would have focused a lot, much, much, much more on prevention. And I know, since we do focus a lot on it in our clinic, of course, we do pay for that in the sense of spending more time. And that's part of any clinic where you spend time talking and listening back and forth, and that does take time. So without time, if you don't put in the time, both from the patient and mostly from the provider's side, because provider controls the time, just by definition, it's appointments set by the provider's schedule, then the relationship cannot really flourish. So that's why that component of functional medicine that allows for more time is very pleasing to my heart. In some ways, functional medicine, it's what old-fashioned medicine used to be, well, plus all the state-of-the-art tests, but we'll get to that. So the second component is acute versus chronic. We do have these concepts that some people who are really big lovers of functional medicine may think that everything has to be treated with functional medicine. Well, I would say that there are acute issues that do not need functional medicine, or not at that time. For example, I will give this example. Like, let's say we have somebody who was hiking and they scraped their knee and then it got infected and now they have an abscess. So if they come to our clinic and I drain that abscess, and it's a simple, straightforward abscess, they're doing well, all is good. So I could just tell them, call me if you have any problems. There's usually 99% of the time, there's no need for follow-up. Or if I'm concerned, I would say, come back in a week. I'll just check, make sure that you're okay. Very straightforward. However, when somebody comes in, let's say, and situations like that do come up. For example, somebody comes in with frequent abscesses, and what happened is that they got antibiotics from several places at different points of time, let's say within few months, and they keep getting more and more antibiotics, and they keep getting more abscesses. And sometimes it could be the same doctor, or it could be different doctors. They may go to urgent care or some other places. So it all becomes basically a constant, constant courses of antibiotics. So what happens in that situation? So in that situation, it's important to understand what is the root cause of this problem. Why is this person keeps developing antibiotics? And sometimes it's very easy. Sometimes it just takes some clinical suspicion, and then, oh, this person may be having methicillin-resistant Staph aureus, or as we call it, MRSA, because MRSA is harder to treat and it requires prolonged treatment with specific antibiotics. And sometimes you can be colonized after the infection, and it may be very hard to eradicate that. But if you don't think about it, and if you're getting disjointed care, or if somebody is in a hurry, then this person now is turning into a chronic receiver of medical care without anybody looking at the root cause. And why is nobody looking at the root cause? Well, because, again, we're coming back to my first point, lack of time. I don't think it's a lack of effort. I think it's a lack of time. And in this situation, I just wanted to demonstrate two issues, acute and chronic. The acute issue does not need functional medicine as an approach. However, chronic diseases, they do need that, because another possibility, or getting deeper now, we're going deeper into this abscess story. Why is this person developing these abscesses? Why did they get infected with MRSA? MRSA is everywhere, so you could touch a door handle and get MRSA. So how come not other people are not getting it all the time, but this person is getting it? So because maybe there's some problems with their immune system. Maybe we should look at XYZ. And then when we do, we may find something has changed in the last few months that led to this patient having a debilitated or weakened immune system. that made them more amenable to these MRSA to attack them. And basically, they now are becoming chronic MRSA colonizer. So all of this, this approach, I just want to demonstrate how the looking for a root cause, first of all, may not be easy, and second of all, it takes time. And my third point is that with functional medicine, as I started saying, we do have old-fashioned medicine, meaning that if you recall, or maybe if you're too young, you don't recall that you would go to a family doctor. You can spend a long time talking not only about your health, but about how you feel, and they knew everything about you. And it was just therapeutic relationship as a relationship on its own. So functional medicine is utilizing this approach because you're talking with the patient, as I mentioned earlier, not only about their medical issues, but also about their lifestyle, about their diet, about exercise, sleep, stress, etc. But also it utilizes the state-of-the-art testing, because without testing, it's basically could be just a talk therapy or just a touchy-feely. You can say that in a disparaging way, although I don't like when people say that. But testing is very important, because if you don't test something, how do you know if you made a difference? For example, if a person comes in with an IBS, irritable bowel syndrome, most likely they do have a leaky gut, because actually IBS is one of the main manifestations of the leaky gut. However, further testing would be extremely helpful, because the words leaky gut are very vague. Which bacteria is a problem? Do they have too much of harmful bacteria? Do they have not enough or insufficient good bacteria? Because once we have their stool test, then we can look, say, oh, they're missing this bacteria. They have very low, and we can replenish them with that. We can actually now have probiotics and other supplements tailored to this person. So it wouldn't be just seeing you, oh, you do have diarrhea and constipation, sometimes diarrhea, constipation, you have IBS, you have leaky gut. All right, you just got diagnosed. I think that that's a very superficial and dangerous approach, because sometimes they may have totally different issue going on. Yes, there is a component of leaky gut, because a lot of us have a component of leaky gut, but you can't just say that one problem explains all chronic medical conditions. So I truly, truly appreciate that there's a very high level of competition amongst functional medicine labs, because all these commercial labs, they're trying to outdo each other and come up with better and better testing. And we as consumers, patients, treating myself as a patient in this situation, as patients, we're all consumers. We do basically see the results of these amazing labs. And the only issue that, of course, we see, and that's an unfortunate issue, is that those labs, unfortunately, are expensive. And that is a problem with functional medicine. And those labs are not simple labs that you can just go to the hospital and get them at the hospital. So I just wanted to focus on these parameters or factors that are important, such as time, such as acuity versus chronicity of illnesses, and the importance of testing, importance of the measurement, because you have to be able to measure the changes that you're doing, be it in conventional medicine or functional medicine. However, my hope for the future is that all of it is blended and it just becomes a human-friendly, user-friendly medicine, where people entering therapeutic relationship which applies to every aspect of their health. So thank you so much for listening. Until next time. Bye-bye.